Welcome to all my dears. Now we are going to discuss about the signs and symptoms of a patient with a decompensated liver disease. As and when our liver fail to compensate the liver function, simultaneously our liver fails and the same way leads to spread of more and more pathological changes in our body, and thereby some tissue changes occur, and thereby increased degree of pathology results in increased level of portal hypertension, and the liver may fail to balance the bilirubin production, bilirubin transportation, degradation of various metabolic waste products, and thereby the noxious metabolic waste products may get accumulated in our body, and thereby various levels of signs and symptoms can be seen. As the pathology advances, due to the imbalance in the bilirubin metabolism, the presentation of our patient may be with a typical case of jaundice. As you know, there may be deposition of the bile pigments, especially in the eyes, or in the mucosa, or in the nail bed, or all over our body, and thereby the patient may complains with the signs and symptoms of jaundice as yellowish urine or brownish urine, or very brown color, or a coffee colored, or a tea colored urine may be the symptom of our patient. Or whenever there are any obstruction, there may be the signs and symptoms of obstructive jaundice as itching of all body, and pale or clay colored stool or a coffee colored stool, etc. may be the symptom of our patient along with the jaundice. And as the pathology advance, and as the enhance or improvement in the portal pressure, as you know, the normal portal pressure is less than 10 millimeters of mercury or 15 millimeters of water. But here, due to the cirrhosis, or due to the fibrosis, or due to the deposition of collagens, the intraportal pressure will be usually more than 30, and that condition is what we call as portal hypertension. In such condition, that leads to transition of free fluid in the peritoneal cavity, or transition of free fluid or plasma in the intracellular areas, and thereby the patient may complaints of peripheral edema. Usually the peripheral edema may be presented as edema in the lower extremities as pedal edema. Usually the same edema may be presented in the right leg, and the same may be transformed into the left leg. And as the pathology advances, the edema may be spread from the lower extremities to the upper level, and the collection of free fluid now be in the abdomen or in the peritoneum, and in such condition we call the status as ascites. So the ascites is nothing but the collection of free fluid in the peritoneal cavity, and when the collection of free fluid, when it get more than 2 to 3 liter, then you will get a shifting dullness and fluid thrill. Keep in mind, the ascites can also be due to cardiac problem and due to renal problem. So ascites and jaundice are the main two symptoms of compensated liver disease. Next, about the on observation or on inspection or on while close observation, you can feel your decompensated liver patient will have a very foul smelling or offensive smelling, or the patient himself may complain that he feels very foul smelling odor from his sweat or from his breath, etc. And such condition is known as a fetor hepatic. It is mainly due to the accumulation of the dimethyl sulfide or ammonia or hydrogen sulfide or carbon monoxide. That means all these are the metabolic waste products. But in a healthy level, the liver will degrade or neutralize all these toxic metabolic waste products. But unfortunately, due to the liver damage, our liver may fail to decompensate or degrade the same or detoxify the same, and thereby all these noxious metabolic waste products may get accumulated in our blood, and the same may be exhaled by our sweat or our urine or our breath, And in such condition, it is known as fetter hepatic A, and it is mainly due to dimethyl sulfide. And as the pathology advances, the same noxious metabolic waste products may get bypassed into the blood-brain barrier, and thereby that may known as hepatic encephalopathy. In hepatic encephalopathy, the main PC of our patient, the patient can't sleep during night, and the patient may wants to sleep especially during daytime, and that is what we call the inversion of sleep rhythm. It's a common manifestation of a patient with a decompensated liver disease. And another problem of our patient with decompensated liver disease may be as flapping tremor. That means there is unreasonable tremor of extremities or unreasonable tremor of whole body. All these complaints are mainly due to, or it can be due to, decompensated liver disease. So the common signs and symptoms of our patient with decompensated liver disease is: number one, as a case of ascites, or as a case of uncontrolled jaundice, or as a case of pedal edema, or as a case of fetter hepatic A, or as a case of inversion rhythm, or a disorientation, or as a case of hepatic encephalopathy. This may be the presentation of a patient with a decompensated liver disease. Thank you.